So our experience across the women's division was rapid change, rapid pace, but maintaining care for certainly maternity care and also in the neonatal unit. But it was lots of changes at rapid pace, trying to make sure we stayed in line with the national guidance, but also listening to our colleagues, making sure that they felt that we knew what they needed, meeting their needs, and also trying to make sure communication was thorough at all times. Teamwork has been phenomenal. I can't speak highly enough of the teams, and that's across the whole. So our gynaecology services suffered greatly quite early on in COVID, where we didn't have enough space to see essential attendances. So we had to stop some work straight away, some work then stopped later on. That meant we had teams who were displaced in terms of location, but also in what they do every day. So how the teams then came together to prioritise the women and each other was just phenomenal, something I've never seen before. And that was across maternity gynaecology, theatres, neonate specialties, and also our colleagues from the Children's Hospital. When we put the flag up and said we need help, the help came, and it came in all sorts of shapes, sizes. I don't know that we got it right straight off, but certainly as things were progressing, we certainly learnt to appreciate each other's skills and work very much cohesively as one big family. Main challenges have been managing expectations, I think. So women have still been coming and having babies, and that has certainly not stopped. But it's how we've been able to deliver those services, and some disappointments where we haven't had extended family members coming in. In certain areas we weren't having partners with all women. By exception we have managed to, but not certainly for everybody, and that's been a really difficult dynamic for our staff to cope with, but also for our women who, you know, we empathise, we understand what the need is, but it's about keeping them safe within our tight estate, but also keeping each other safe and making sure that it's an unusual way of working, because normally everything we do is focused on the woman, whereas through COVID everything we've done has also had to focus on our colleagues and our staff. And I've certainly learnt that by keeping our staff safe and making sure that they feel safe and protected, they absolutely rise to it and they give the best possible care. So it's a very different way of working where safety of our staff had to come first. So I would like to say a huge thank you across all teams, services. That includes our laboratory teams who have just propped us and really been there for us throughout, to our communications team, because without them we haven't been able, we wouldn't have been able to reach the women and work as we have done. Our local maternity colleagues, we've worked in a very different way. We've almost been ricocheted into working differently, but it has meant we've been able to give the right care at the right time at the right place. Our governance teams, our education teams, our clinical facing teams, gynaecology, maternity, neonates, everybody together, and the leadership teams, the colleagues who've come together to support everybody. It has been exhausting. It's been a huge learning curve. I don't think anybody would look backwards and not realise what we've achieved, but we've done it together as one big family, and that's what has shone through and certainly kept me going.